Hey guys, it's Dr. Justin Marcagiani here. I am back for another live health update. Before we do, smash that like button if you guys are enjoying these videos. Put your comments down below. We'll be talking about blood sugar issues and the coronavirus today. Really excited. New journal article in the New England Journal of Medicine. I'm going to break it down for y'all, make it so it makes more sense and you can apply it to your daily life. And if you guys are enjoying it, like button, thumbs up, smash that bell so you get notifications of great new content coming your way. All right. Hope everyone's doing phenomenal today. So the theme of the last couple of weeks here with this coronavirus is the hysteria math. Now, again, the mortality rate has been going up a little bit for the U.S. We'll talk a little bit more about why that is. But in general, the take-home thing is we have hysteria math and we have real math. The difference between the two is we know with the real math, we have the 10x asymptomatic rate. It could be higher than that. We have the asymptomatic rate factored in. And when you have the asymptomatic rate factored in of at least 10x, we have data showing it's about 86% right there, okay? We have data supporting that. But in general, you do 243,000 cases, 5,883 deaths. That's a 2.41%. Move the decimal place ones to the left. That's a 10% reduction, or I should say a 10x asymptomatic rate. Now you're at 0.24%. 86%, which is like that study says, is 0.34. Again, this is 14 and 10 times less than the original World Health Organization assessment. They said 3.4% was going to be the death rate. So I'm just trying to, let's just say, shake y'all a little bit that maybe the original estimates were kind of a little bit off, all right? And then the hysteria math worldwide, 1 million people finally have it. Okay, 1 million finally have it. By the way, just so people, well, I'll show you that later. 52,977 dead, 5.23% on the hysteria math. And again, when you factor that out here, that's 0.52 or 1.79, between 6.51 times lower than the WHO, or 1.9. And again, we compare it to the flu. Big difference here is total cases of flu confirmed. This is the deaths. This is the total people that are lab confirmed. We have the bigger number. That's the number that we're missing up here. Okay, that number is going to be 10 up to 20x more people, according to Dr. Chavez over in Ontario. So once we know that here, if we did the 23,000 dead over the 230, that would give us a 10% death rate. That's where the hysteria comes in. When we dehysterize it, that's where we factor in the asymptomatics. And that's where we get the bigger number of 23 million, and that brings it down to 0.10. So you can see here yesterday, 2.38, 5.05. We're up a tiny bit there for sure. But I'm bringing comfort, as always. Bringing comfort. All right, so off the bat, a couple things. This actually came by my desk today. This is one concerning thing for me. Okay, this is here. You guys can vet this out for me. If this isn't legit, put it in the comments and we'll revise this. But Stephen Schwartz, Director of Division of Vital Statistics, National Center of Health. Do I need to make any changes at the jurisdiction level to accommodate new ICD-10 codes? They're trying to figure out what the diagnosis is, what the cause of death is. Should COVID-19 be reported on a death certificate only with a confirmed test? COVID-19 should be reported on the death certificate for all descendants or all descendants where the disease cause or is assumed to have caused or contributed to death. So the hard part is the assume part. That's where the really difficulty is. That's where we could potentially have a little bit higher of a death rate because of the fact that there may be a lot of comorbidity. Someone comes in with a heart attack, Alzheimer's, dementia, they die. They may have passed anyway because of their other ailing ailments, but they die with the virus, not from the virus. So that's the big driving factor is here. A lot of sick people dying with the virus. Are they dying from it? That's really the big take home. Now, in the article in Italy here, that's another one for later on. Let me show you this article here. Yeah, Telegraph. So on reevaluation by the National Health Institute, only 12% of certificates have shown direct causality from the coronavirus, while 88% of the patients have died from at least one premorbidity. Many had 2 or 3. And this was the National Institute of Health. I think the professor was this guy, Martin McKee. Or actually, I'm sorry, Richard Riccardi right there. So that kind of gives you an indication here, right? So only 12%. So my concern is that The death rate, as high as it is, could actually be a lot lower, right? The 12% thing, that's a big one, okay? That's really, really important. Just wanted to highlight that. And if you guys can vet that other information I gave you, that'd be helpful. Also, a couple things I wanted to highlight. I got more great info. All right, this came across my desk today. COVID-19 in critically ill patients in the Seattle region. This is a case study just produced. Again, this is small, but they're on a lot of these. Doctors aren't really focused on posting case studies to the New England Journal of Medicine while all this stuff's happening. It's probably the last thing on their mind, but some people are actually documenting it. So 24 patients, COVID-19. One thing I wanted to highlight. The most common cause was cough, shortness of breath. Patients had a fever, admissions. 58% had diabetes mellitus. I've heard many other doctors who have family medicine or internal medicine practices tell me, Dr. J, over half of the patients that have this thing, they have pre-diabetes or diabetes. This is a big deal. And again, you can have pre-diabetes and still look relatively healthy, right? Pre-diabetes is your blood sugar on fasting is about 110 mgs per DL. Diabetes is 126 or higher. And when that happens, when you have higher glucose, you start surging more insulin. So you have a fasting insulin usually greater than 8, 9, or 10 on a fasting insulin blood test. Now that does a couple of things. It's going to decrease your immune function. It's going to decrease your phagocytes. So you have various white blood cells like monocytes, neutrophils, mast cells. These can essentially act as phagocytes that will gobble up, right? Phagocyte in medicine terms means big eater. So it's going to eat bacteria and viruses. Here, let me show you this data here. This is really interesting. So this is the New England Journal of Medicine. So this is a big thing because no one's talking to you guys about what you can do to get your immune system stronger, all right? Throw washing your hands out, social distancing, quarantine. I get that. That's decreasing exposure. What do you do to make your body an impenetrable fortress, right? One of the big things is getting your blood sugar under control. Let me walk you through what's happening. All right, so I think I did this one here. Yeah, okay. So phagocytic activity is impaired in type 2 diabetes mellitus and increased after metabolic improvement. So yes, we're talking about type 2 diabetes, but there's a spectrum, okay? And there's a lot of people that are going to not quite be diabetic, but be pre-diabetic, and if they get their blood sugar better, will they see an improvement with their immune system? Yeah, I'm going to guess yes. But glycemic control, that means eating foods that don't convert to glucose and sugar in your bloodstream, is related to type 2 diabetes. Our results suggest that improvement in phagocytic activity can be added to the beneficial effects of metabolic optimization. So, man, these people in research, they just try to say things that could be said with so fewer words. It's like, who is it? Was it Mark Twain? Brevity's the wit of soul. What the heck this guy is saying, if you get your insulin and your blood sugar under control, you got a stronger immune system. Why can't he just say it like that? Man, it's like speaking a different language. So blood sugar, insulin under control, stronger immune system. It's like a seesaw, right? Weaker immune system, blood sugar is more out of control. Blood sugar, glucose, and insulin more in control. Stronger immune system. That's the take home. So what does that mean for you? It means fruits, vegetables, maybe even do more vegetables, less fruit. Good healthy fats, good proteins, quality matters. I just want to give you the data on that and show you the actual science. All right, so where are we at trend-wise today? This guy is a guy you should be looking at if you want to follow some of the trends. This guy here is, what's his name here? Chris Murray. I think his model is going to be the most accurate here, okay? Now, I'm going to show you my model, okay? Reason, logic, and evidence, intelligence guided by experience. Let me show you my model. Okay, so I'm used in Italy. We're not going to be using the Chi-Coms model. I think the communist regime has hid a lot of data from us, and I'm just saying it's questionable. Let's go look at Italy, though. So what I've done is I just kind of moved this model around so we can look at when Italy started, compare it to when we started, and then look at where their high point was, their bell curve was, and compare it to us. So Italy's bell curve, where they started hitting the top of that bell curve, was March 27th. We go straight down here. We take this amount of time off. First off, I lined it up here. This is their first death, February 29th. That equals March 14th here, okay? And then I looked at their bell curve here, where they hit on March 27th. I took the same distance here, and I extrapolated it to the left, as you can see, and I went down. So we're looking at March 24th, 23rd. March 24th, March 23rd. So the equivalent from that is, if that's 23rd to the 1st, that's 8 days. So then we're looking at April 9th, April 10th, April 11th in that area is when I think we'll be at the top of the bell curve. April 9th through 11th, okay? That's when I think we're at the top of the bell curve. Now let's go compare. This guy here, Richard or Chris Murray, thinks it's going to be April 14th. Let me find his projection. Hold on, I had it up. I think that's it. So if we look at his projection right here, he thinks demand, capacity, here it is, projections. I think this is it. Yeah, April 15th. This is on all resources here. Let me find it, guys. Deaths per day. Yeah, peak is, he's thinking April 16th now. That was April 15th, 14th. So he's thinking April, so he's thinking about 5 or 6 days later, okay? So 2 weeks till the projected death rate is maximized. So this is a really good thing to look at here. And the cool thing about this is you can do it per state, right? So check this out. Look at New York. Go down to New York. April 9th, and this is until peak resources are used. You can go to deaths right here. 8 days. So they're thinking 8 days. They're thinking April 11th they'll be at the top here, deaths. So they're on the downward side here on April 11th. And then this is their peak usage is April 9th. So doesn't this make you feel a little bit better, guys? It's like, okay, wow, there's like an end to this thing. I think a lot of the fear is, one, people are just like, exponential rate, logarithms, it just keeps on going like a ski ramp. And it's like, when does it stop, right? So I get that. And just kind of adding a little bit of practicality to it and using some models that I think make a little bit more sense. I'm using my model based on Italy. And again, we're using Chris Murray's model. He's at University of Washington. So you could take a look at that. And then if we can do, let's go United States again. Okay, United States. And then they're going to be 14 days. So that's going to be April 16th, and that's going to be projected right there. Hope that makes sense. And then he is projecting out, I think, a total of, so you can see here, total deaths, he's projecting out May 1st. He's projecting out 68,000, 66,000 on May 1st. So we'll see how he does on the total deaths. We'll have to see. Right now, today was actually a good day on some of the trends. So you can look here, 1,049, 912. But if you take in today's stats, U.S. is at 781. So we'll see how that fares out. If maybe we're coming back down here. Maybe we're coming back down right here. So here we go, 912, 1,049 yesterday. Maybe we're coming back down here where my mouse is. That'd be nice, wouldn't it? So that just kind of gives you some perspective. We talked about Italy. Here's Italy. They're around in the corner, guys. I think they're probably 25% of the way down, maybe 20% of the way down. And you can see where they're at here death-wise. They're at 13,000, 115,000 total. And again, we're doing pretty good as a country. We're doing pretty good. Go here, worldometer.info. The marker I want you to look at is total deaths per 1 million. All right, total deaths per 1 million. Italy at 230, Spain at 221, Belgium 87. Let's go look at us. We're at 18. 18, okay? So you look at Italy, right? Italy's at 230. 230 divided by 18. Almost 13 times better. That's really good. That's excellent. Okay, excellent there. Let me keep on rolling. So I gave you a couple of things here concerning about the death rate and how a lot of people just may be dying with corona, but not of corona. That's one big component that I'm concerned about. Highlighting the metabolic syndrome here. 58% had diabetes and or blood sugar issues. We talked about that and dovetailed that with the immune response. Here's phagocytosis over here. You can see your little virus. It invaginates. It engulfs it. You have various phagosomes. It destroys that virus and it absorbs it and poops it out. And so blood sugar, really important for immune function. We talked about my model here with Italy. So I'm saying 9th, 10th, 11th. Chris Murray is saying, I think, April, 16th for the U.S. So we'll keep an eye on it. We'll keep an eye on that. And I hit all the major stuff here. I think I may have, guys. We talked about the real math, what it's missing. And again, I know like a broken record on this. There are new people coming every day, so I feel the need to repeat myself. If not, they're going to come into this whole thing and may not quite make sense. All right, hope that makes sense, y'all. If you guys want to dive in deeper with me, click down below. I got links. I'm available worldwide, telemedicine doctor. See patients all over the world. Love that. Let me go to some questions. See how I can help y'all. Okay. Person with asthma has been nebulizing glutathione, but during each instance, there's a lot of liquid mucus that starts coming out of the nose. Is it good or normal? So first off, if you're noticing a lot of mucus come out of the nose, you should be working on getting your sinuses cleared out. You get a really good, sinus rinse device. You can do Neilmed, which is at a local Walgreens. You can get the Neti or the Xlear packets, that have the xylitol and the minerals, and they will come with their own bottle. And then do that 2 or 3 seconds each nose. Just Google my video on this. Just type in Dr. Justin Health, nasal sinus flush. I did a video where I actually did it myself live on camera. Lucky you guys. All right, cool. So clean out the nose, then do it afterwards, okay? And then add in some NAC to get some of that mucus down. How do you know if you have prediabetes? Tested my fasting glucose. It was 86, safe range. Okay, so a couple of things. How do you know if you have prediabetes? It's a great question, man. We got some smart listeners here. I love it. So first thing is you can look if you have fasting insulin greater than 8 or 9, or let's say 10 in the morning. Fasting insulin is a pretty good indication. Number 2 is eat a meal. Take your fasting glucose before you eat, and then do a 1 hour, 2 hour, potentially 3 hour test of your meal after you ate. So you eat let's say at 7 a.m. You take right at 6:59, get your fasting, and then do 1 hour right afterwards, 2 hours, 3 hours. We want your blood sugar ideally to be between 120 and 140 after 1 hour, between 120 and 100 after 2, and ideally back below 100 after 3. If for some reason you cannot bring your glucose down after that amount, number 1, you're more than likely trending in that pre-diabetic range, and you got to adjust the foods. And you want to add some extra nutrients in to help that too. Okay, excellent questions, guys. Yes, thank you on the simplicity of the language. You're totally welcome. I swear, people, they create their own language because they don't want to talk to people. They don't want to make things simple. So I'm trying to make it easy, because if you don't get it, you can't apply it. I want you guys to be healthy and apply it. Yes, curious your advice on fasting glucose ranges. Hopefully that made sense and that answered it. If someone has type 2 diabetes and dies with COVID-19, why can't the death certificate both highlight both conditions being present when the patient died, making both contributors to the cause of the death? Well, I mean, how would that affect the death stats? Does that mean half a death for COVID? It's a really interesting question. And if we go back to this here, it answers a little bit in this question here. It says if the decedent had other chronic conditions such as COPD, asthma that may have contributed, these conditions can be in part 2. So we don't have that part 2 there, but how much does part 2 get highlighted in the cause of death, right? It's a really important question, and that could be increasing the stats. Now, another big thing, why I'm not concerned of a round 2 of COVID. So number 1, as people die and get COVID, well, as people get it, if 90% of people get it, are asymptomatic, guess what that does for the herd immunity in the area? You have all these people that are impenetrable to it, meaning they can't get it because they already have antibodies that knock it out. And then also because they've already have the antibodies, they're also not contagious. So what does that do? It prevents the spread. So that's why I'm not really that concerned of a second wave. We didn't see it with MERS or SARS. With flu, it's a little bit different because there's seasonal mutations, but there's no reason to think that this is going to be seasonal. And part of the reason why it's seasonal is because a lot of flu stuff is avian. This is bat. I mean, this doesn't seem like a natural migration thing that'll happen with bats year to year. So we'll keep that in mind. Let me give some Facebook love here. Okay. When it starts to go down, go down, people start to go out again. What stops it from peaking all over again? Exactly what I said. Asymptomatic people will have passive immunity, and that immunity will hopefully prevent people from passing it around. Remember, 90% of people will not show symptoms. They will develop antibodies. They'll only shed the virus for 2, maybe 3 weeks. Then it's done. Now they have the antibodies, and they were essentially immune. And that will create this barrier around people getting infected. And again, if you are sick, compromised immunity, chemotherapy, immunocompromised, elderly with comorbidities, stay inside. You should probably be inside for a while. And again, those people typically aren't going to be major contributing factors to the economy, right? Probably just on disability at some level, or they're just older where they've retired, so we can kind of get back to work, right? I'm really worried about the suicides of people losing their life's work. If you have the virus or a virus and are trying to recover from home, what is the most important thing to look out before going to the ER? You could test your oxygen saturation rate. So if you're really starting to not really get your oxygen up because the exchange between your deoxygenated and oxygenated blood is not good in the lungs because of all that mucus and inflammation, that could be a good indication. Go check out Heads Up Health. Dave Korsunski did a webinar on this topic on the top 4 vitals, but he looked at blood pressure. He looked at oxygen saturation. He looked at heart rate. I'm going to guess heart rate and blood pressure would go up because oxygen's low. Your body's going to be trying to perfuse and get that blood circulating faster. So I'm going to guess oxygen or blood pulse rate up. I'm going to guess heart rate up, blood pressure up, and then, of course, oxygen saturation down. I'm definitely positive on the oxygen saturation down. Great question. After all my research into H. pylori, I wonder how many of these people had this infection. I mean, they could. I mean, people, the more infections you have, the more weakened your immune system will be. I have exiliar packets and I'm doing the nasal rinse for at least a week or so, still having the mucus come out of my nose. Would you recommend something stronger in the saline like oil of oregano? You could do a little bit of iodine drops, and you could do a little bit of silver drops, and you could rinse out that way. But just breathe in the glutathione anyway. It should be fine. But if you need, you can do the Mucinex, which is the guanefacin. Guanefacin, I think, is the herb there that helps with that. But you want the mucus. The mucus is shedding a whole bunch of crap and crud from the virus interaction. The more green the mucus is, the more white blood cells are clotting and agglutinating, the more the immune response. You want to flush it the heck out of there. If I can't test fasting insulin, only fasting glucose, what do you suggest with the testing timing that would be the best way to know if you're pre-diabetic? Do the fasting blood glucose test, fasting 1 hour, 2 hour, 3 hour after food. Yes, I'm thinking depression, that's going to be a consequence after the social isolation. I think it's going to be a really, really big deal. Sean writes in, can one get a GI map test done at this time? Yes, they can. Feel free, email my office at Justin Health. I have staff there that would be happy to help you. Or you can go online, justinhealth.com/shop. Lab test section, and you'll find the GI map in there. Do you have oxygen saturation measures at home? Not sure what to go on at home or to know the ER is best. You can get one of the ones for your finger. They're like $20 on Amazon. I'm pretty sure Amazon's still delivering. Let me check for y'all. Bringing it right to you guys here. Hope you guys like it. Okay, we'll do pulse ox. There we go. Boom. Here's one $60. Let's see which one. So maybe this one. Well, this one does on the Garmin one on your wrist. That's interesting. So there's a couple that are available. Hope that helps. Okay, let me keep rolling. Where'd you guys go? There you are. Okay. Do we need to dilute colloidal silver 10 or 15 p.m. into water before nebulizing it? Just do a couple of drops. Just do a couple of drops in there. It's fine. See how we do. If it's 10 to 15 ppm, you're probably fine. Again, I kind of have my MedLegal CYA, like it's a little bit more controversial. Know about Argyria, your skin turns blue. It's only going to be pretty much with crappy colloidal silver. Do the nano silver. Sovereign silver is good. Silver Sol's good. Smaller the better. Is there a way to test insulin levels at home? No, there's not. But the functional glucose tolerance test, the one I just told you, is the best. How often would you recommend nebulizing glutathione a day for someone with asthma and recovering? I would do it at least 3 times a day. Little girl writes in, yes, awesome. On the Amazon, fine, thank you. Yep, you're welcome. Awesome. All right, Susan writes in, Johnson baby shampoo added to a saline sinus rinse, loosens up biofilms and mucus. Okay, all right. Interesting, very cool. Did I answer all your questions? All right. If a cough got better after a round of antibiotics, what does that tell us? It tells me that you probably got some underlying mucus crap, maybe a postnasal drip happening. So do the sinus rinse, throw in some extra iodine drops into that rinse, maybe some silver drops, and you can kill some lingering bacteria. If you want to go the antibiotic route, I don't recommend taking an oral balm. Just do the sinus stuff up the nose. But I'd say 9 times out of 10, the saline rinse kills it and it knocks it out without needing the antibiotics. Excellent. All right, guys. Anything else? Let me know. Today's been real. I really appreciated connecting with y'all and getting all your great questions. Put your comments down below. If you got the dreaded corona, let me know. I want you guys to be supported. I want to get you through this thing. What are the main application points? Get your blood sugar in check. Keep your carbs more to vegetables and, maybe some lower to moderate sugar fruit. Try to get some walking if you're in an area of the country that's not totally totalitarian, shutting you down from getting some walking. Try to get at least some walking, some sunshine. That's going to be helpful. We're having high pollen in our area right now. How best to treat allergies? Well, two birds with one stone. Quercetin is going to be excellent. It's going to help with the inflammation. It's going to help with the histamine. And it's also shown to help with the modulating the inflammasomes, which is from the inflammation of the cytokine reaction with viruses. So I like quercetin. You are a blessing. Like to book you soon. Oh, awesome. Thank you. I really appreciate it. I'm flattered. S-acetylglutathione, better than liposomal. It depends. S-acetyl, I've heard good things about. I like liposomal, though, but I've heard good things about it. So if you have S-acetyl, still use it. All right. Excellent, guys. Man, I try to go on here for like 5 minutes, 8 minutes, and I just get sucked in. You guys are just too entertaining for me. All right. I'll be back tomorrow morning, y'all. So appreciate it. And I'll be doing a podcast tomorrow with an expert I got lined up as well. If you guys enjoy this, share it online, Twitter, Instagram, whatever. Get it to people that you know and love and care. And today's been real. You guys have a good day. Take care, y'all. Bye.